First-line therapy. A 24-year-old university student presents with intrusive thoughts of contamination and spends 4 to 5 hours daily washing her hands. She recognizes the behavior as excessive but is unable to stop. She refuses medication initially. What is the most appropriate first-line therapy? A. General supportive counseling. B. Exposure and response prevention, CBT. C. Short-term benzodiazepine therapy. D. Risperidone augmentation. Explanation. ERP-focused CBT is the treatment of choice, effective in 65% of patients, while medications carry relapse risk when discontinued. Supportive counseling and benzodiazepines are not effective for core OCD. Reference CTC 2018, pp 159-161. Or Q2. Pharmacotherapy Choi-old man with severe OCD has failed an adequate 12-week trial of sertraline at 200 milligrams per day. He reports persistent compulsive checking and impaired functioning. What is the next most appropriate pharmacologic step? A. Switch to another SSRI at maximum tolerated dose. B. Start risperidone immediately. C. Add clonazepam for anxiety. D. Switch to bupropion. Explanation. After inadequate response to one SSRI, switching to another SSRI or clomipramine is recommended before considering augmentation. Bupropion has no proven role in OCD. Reference CTC 2018 p. 161 Q3. Augmentation strategy. A 40th OCD shows only partial response to fluoxetine 80 milligrams per day after 16 weeks. Which augmentation strategy is best supported by evidence? A. Lithium carbonate. B. Risperidone low dose. C. Buspirone. D. Lamotrigine. Explanation. Low-dose risperidone is the best-studied augmentation agent in SSRI-resistant OCD. Lithium, buspirone, and lamotrigine lack strong supporting evidence. Reference CTC 2018 p. 161 and #Q4. Duration of treatment. A 28-year-old man refluvoxamine 300 milligrams per day plus CBT. He wants to stop medications after 4 months. What is the recommended minimum duration of pharmacologic therapy after response? A. 6 months. B. At least 1 year. C. 2 years, indefinitely. Explanation. Guidelines recommend 12 months of pharmacotherapy due to high relapse rates after premature discontinuation. Gradual taper is advised. Reference CTC 2018 P161. Q5. Pregnancy-associated OCD. A 30-year-old woman in her thigh develops intrusive thoughts of harming her newborn. She is distressed and avoids being near the baby's crib. Which is the most appropriate initial management? A. Start paroxetine 40 milligrams per day. B. Immediate referral for psychiatric assessment. C. Initiate ERP-based CBT. D. Switch to risperidone. Explanation. CBT with ERP is first line in pregnancy due to safety. SSRIs may be considered for severe impairment but carry risks. Antipsychotics are not first choice. Reference CTC 2018 pp 161-163. Q6. Pediatric OCD. PANDAS consideration. A 10-year-old boy presents with OCD symptoms following a recent streptococcal throat infection. He repeatedly checks doors and windows for hours. Which is the most appropriate next step? A. Immediate initiation of risperidone. B. Cognitive behavioral therapy. C. Confirm diagnosis and treat underlying strep infection if present. D. Start fluoxetine immediately. Explanation. Pediatric autoimmune neuropsychiatric disorder associated with Streptococcus pandas is controversial but requires consideration. Confirm and treat infection if present, alongside standard OCD management. Reference CTC 2018 P159.